You're listening to the Good Question Podcast with Richard Jacobs. Our goal is to make each of our guests exclaim, that's a good question. I don't know the answer. Because when that happens, it means you, the listener, may be inspired to learn more beyond the interview and to ask great questions yourself that lead to new insights. In this podcast, we cover historical and current anthropology, comparative religion, and history. Welcome, and let's get started.
Hello, this is Richard Jacobs with the Good Question Podcast. My guest today is Amy Ingle. She's the founder and owner of Sweet Spot Med Spa. They've got 2 locations that are doing well. And she's an injector and educator at Med Aesthetics Academy. She's a veteran clinician of many years and respected industry educator. She's known for educating practitioners across the U.S. in both injectables and the business of a med spa. So welcome, Amy. Thank you.
Thank you for having me on.
Yeah, tell me a bit about your background and how did you get into med spas and these treatments?
Yeah, well, I graduated from the University of Missouri in 1995 from the School of Nursing, had my bachelor's, went into ICU pediatrics and then NICU. That was up in Missouri. And then I moved down here to Florida and worked on a couple other places like home health, did wound care. And I decided to go back to school. So I went and got my nurse practitioner license, degree, and master's in nursing. And I knew that I wanted to do something on my own. I've always had an entrepreneur spirit. I owned a home health agency. I owned some other companies, little small companies. And so I thought, well, what better than to do something that's cash pay? I don't have to work with the government with Medicare and Medicaid. And aesthetics was just kind of like my calling. It's really exciting. It's always on cutting edge. And the clients come to you because they want to, not because they're sick, but it is also rewarding in other ways as well. So I started my practice about 8 years ago in 2017, opened up a little tiny spa and it was just me part-time. I was still working at the hospital. After about a year, I brought on another nurse practitioner. And so we really grew the business, and then I added another, and then we outgrew our area, our little space that we had. So we ended up moving to a bigger location. And I also have a second location now in Punta Gorda. So one's in Fort Myers, one's in Punta Gorda, Florida. And so we've been open for 8 years.
What if people go to a med spa? What kind of treatments do you do?
Yeah, well, we do a lot at my medical spa. Basic med spa treatments would include like Botox, Dysport, Juvederm. There's a couple of neurotoxins out there that you can choose from to help with wrinkle control in the face. And it also has other indications in the body. Also, derma filler. So for wrinkles, or if you want volumization in your lips or your cheeks, we can do that with what's called hyaluronic acid. We also have biostimulators that actually stimulate your own collagen in the body. Those are by injection. We have laser treatments, facials. We do some radio frequency, some skin tightening, some body contouring. We do a lot.
Oh, well, I've never had it.
You haven't?
Yeah. I'm just between my old wrinkled self. I'm okay.
We do have some male treatments. We do see quite a few men that come in with hair loss. And so we help treat that with injectables and also with nutrition and supplements. And then we also do what called the P shot. We call it the Atom shot. And that's indicated for ED. We also have female sexual rejuvenation as well. So beyond just the Botox and fillers, we do regenerative medicine, which really complements both men and women.
I was scared to ask, but what is the V shot?
So it is a couple of injections that we inject platelet-rich plasma to stimulate new cell and blood vessel repair. It's not a one and done, but it helps with ED, Peyronie's disease, and also can help with increase in length and girth.
Oh, so the birds get like a series of shots in their privates, and then it's...
Yes. And it works. It works. A lot of my clients that get this done can get off their Cialis, off their Viagra. So it works.
And women do it too? Is the same injection process work with that?
Yes. And for women, it's mainly for like vaginal dryness, libido, any kind of pain during intercourse, and also incontinence.
What about HRT? Does it make sense to integrate that with what you're doing or not?
Yeah, absolutely. We do not do hormone replacement therapy. I send my clients out to someone else that does that. However, we do complement with treatments. So say they're getting hormone therapy, and they're having, these issues of lack of, they're dry, they have vaginal dryness or lack of libido, I'll send them to get hormone therapy treatment and also do treatments in my spa to help with that as well.
How come you don't integrate all of it? Is it just too much to do with?
Well, it is. I always laugh. I say, well, I don't want to deal with the grouchy menopausal women in my spa. But really, no, it's just we do so much already. I don't want to dilute our knowledge base. So I just would rather send them out to someone that does it every single day and is up on the medication and the dosing.
So what are some of the most common reasons why people want each of these treatments? Like the ED, it's quite obvious. Is it more like older folk or is it anyone?
Surprisingly, I believe that the age group that are coming in and getting these treatments is getting younger and younger. So I would say about 7 to 8 years ago when I started, I saw a lot of women in the age range of 40 to 60. Now it's shifted. I'm seeing more between the ages of 30 to 50. I think it's because of social media. I also think that women that are younger in their 20s, they're seeing how their parents look when they're older, and they know there's options out there where they can start to get, say, a Botox injection to help with lines in their forehead starting early. So then as they get older, the lines look softer or they're non-existent because they started early. If you wait too late, say somebody that's 60, 70 years old that has been creasing their forehead their whole life without getting any treatments, they're going to have deeper lines. They're going to have what's called static lines. Those are the lines that you see when you're not using your muscles, you're not contracting. And those are very difficult to reverse. By starting younger, these women are figuring out that if they do start younger, then they're going to prevent those static lines in the future as they get older.
Okay, that makes sense. Yeah, because normally if I see someone younger and they get plastic surgery, or I know that's not what you do, but they get these treatments, I think, why? You're young, you look fine. It actually sounds like it's smart to do it before they get older, and it's hard to do it.
Right. Yeah, it's very hard to reverse the damage. Preventative is better.
Yeah, well, it makes sense. It's probably a universal thing.
Yeah.
So what about filler? Like you're injecting this like wallpaper paste material or something to fill out people's lips and cheeks?
Well, actually, what we use is called hyaluronic acid. It is made in a lab. It's from a culture, and we have hyaluronic acid in our bodies already. So this is it's not your own. It's lab made, but it is a natural product that is introduced into the tissue with a needle, and it's delivered into where the lines are or to lift. There's certain areas that we place it to help with lifting of the face, the cheeks, contouring the jawline, extending the chin, putting in the lips to give a little more volume. As we get older, our lips get thinner and thinner. So we'll have older women come in and just get a little bit of touch up around the lip line just to shape it like it was when she was younger. I've done a couple of men's jaw lines to where they want that chiseled look, so we can place it along the jawline and give them more defined jaw definition. It lasts anywhere from, it depends on what product you're using, but it lasts anywhere from 6 months to 15 months. If you go by the literature, it says about like a year to a year and a half, but I do have some really good results from what we call RHA. It lasts up to, I've seen it last past 2 years, but everyone's different. Everyone's metabolism is different. So there's not like a standard. It could be different for every person. I do not use the products that last 6 months because I just think that's just not long enough. So I pick the longer lasting products, and I don't put a lot in. I'm very conservative so that it looks natural.
Yeah, what I see, like women have like duck lips. Is it just like there's a low level of skill in a lot of practitioners, or is it just a procedure that's very difficult to do well?
So lips are very difficult. Not all lips are the same. They're all different shapes, sizes. The lips have these little like pockets in them. Like there's these little tubules. And when you inject, if you're too deep, then you're going to cause some abnormalities in the lip shape. If you're too shallow, you may not put enough in to make a difference. It's all in technique. And you're right, it has to do with the provider's, I wouldn't say background, but experience is really is where you learn it, is experience. Just doing it over and over and over and understanding the anatomy of the lip, and also that lips are not all the same. So you have to really tweak every client differently so that they end up with a very natural looking lip augmentation. Or just by putting a little bit in, you can make the lips look more moisturized as well.
Are there different levels of technicians that have different levels of training? Like, if I'm a woman and I want to get this done, can I find a master technician instead of the run of the mill? They may cost a lot more, but I want it to look right, let's say.
Yes. Okay. So in my state, you can do injections if you are an MD, a DO, an NP, nurse practitioner, a PA, physician assistant. Dentists can do them. I believe RNs can if they're under the direction of a physician. But when we go to school, if you don't go through a plastic surgery rotation as a physician, you're not going to learn how to do this. I would say probably 98% of us that do this, we have learned outside of our formal education. So we, for instance, I went to a training to learn the basics. And it was the basics because it took me more and more and more trainings to really master what I do and to get good results, and also a lot of practice. So I would suggest, like, if you're looking for somebody to do like some augmentation of your lips or your cheeks, don't go to a new little med spa that just opened up or that has maybe one provider. You need to go somewhere that has multiple providers, that's been open for longer than 2 to 3 years. They've been practicing this for more than that. And they have a large client base because that means that they're doing a lot of volume. And so they've had a lot of practice. Also, those that use name brand products and buy them from the company that makes them, that is really important to know as well, because say for instance, I learned how to inject Botox from the company that makes Botox, Allergan, and they actually sent trainers to my area and I learned directly from them. So if we're learning directly from the companies that make the products, we're going to learn the best technique and to be safe as well. You've got to be very safe when you do these injections.
Oh, what can happen? Like contamination or like poking someone or tearing through the tissue? Like what happens?
Yeah. So if you aren't keeping, protocol of safety, there's multiple things that could go wrong. You could get an infection. You could cause an infection because maybe you didn't wash your hands, your needles aren't clean, or and most nurses, nurse practitioners, nurses, we've all gone through so much training on how to be, sterile and how to do clean technique. So, really that is probably the least, I would say it's not really a concern, but still be aware of your environment. If you go into a spa and it looks dirty, then just turn around and walk out, because this is an environment we have to keep very clean. Another thing that we have in our consent form so that the patients are aware is that when we do these injections, it can cause bruising. It can cause swelling. We're introducing a needle under the tissue and there's a lot of blood vessels. And so that can happen. Also, one of the concerns is a vascular occlusion. When we inject filler, if the filler gets into a vessel or butts up and against a vessel and causes the vessel to collapse, blood flow is diminished or non-existent to that tissue and can cause tissue necrosis. So that's probably the most severe. And, I would say, that's probably one of the most severe things that we discuss with our clients in our consent forms. One of the things that is really scary is that there are some areas of the face when you inject, there is always a possibility. If someone doesn't know what they're doing, there's always a possibility of blindness, which that's probably one of the most, probably the scariest, because it goes fast. And so we just have to be trained, like the anatomy is really important, and where to inject and how much to inject in one area, and where to put the needle, and also if something were to happen, how to take care of that, how to make sure that that client is safe. So there's a lot of things that go into injecting that I think our clients don't think about, but we're constantly thinking about.
Well, since you teach, are you allowed to make certifications, like your own certification system, where you've trained or your system trains techs, and then you're like, all right, I say now based on what we taught you, you're level 1 or level 2, like Botox clinician or something.
Right. Yeah, there's really not a standard certification. So if you meet this, and this, it's kind of just all over the place. You'll see training programs that say you'll be certified in Botox. Well, what does that really mean? You did like 2 treatments in your class, and that makes you certified. So it's kind of really a gray area. I would say, though, experience and how many you have done really set you apart from the master injector versus the basic injector. So
Yeah, how do you practice this?
well, I could tell you how I practiced it when I started. I had friends that I practiced on. I'd have new clients that would come in, and I'd explain to them. And I gave a lot of discounts saying, listen, I'm training. Will you let me practice on your lips? And so that's kind of how I started. I watched a lot of videos on YouTube. I won't lie. I did that. I did go to a lot of trainings, a lot of hands-on trainings. And that's just kind of where I started. And just the more that I did it, the more I understood, my limitations and the anatomy. And that's just kind of where it all spun out.
Okay. Is there anything people can do besides not going to, let's say, a new center? How do they ascertain that someone is good? Do they say like, hey, how many times have we done this? Or what do they ask?
Yeah, I think that's a good question. First ask, what are your credentials? What's your education? How long have you been a nurse practitioner, or how long have you been a physician? There's a lot of physicians that have primary care practices, and they decided just to bring on aesthetics. So they might start doing Botox. Dentists do it too. They'll bring on Botox. So they're bringing on filler, and they don't do a lot of it, but some people think that because MD's behind their name, they may be very proficient in it, when actually they're more of a primary care doctor. So you really have to look at the mix of what they're doing, how much volume they're doing. An excellent way for patients to see if the clinic or the Medi-Spa is going to be a right fit is to look at reviews. I think more times than not, I've had clients tell me, I picked you because you had such good reviews. And that made me feel great, but then also that shows to the people out there that haven't been to our spa that we have clients that love to keep coming back, and they're happy with their procedures.
Yeah, I mean, good reviews, yeah.
Yeah.
Yeah, why is it that it's weird? I see you really have a lot of money, movie stars, influencers, and all that, and some of them look terrible. I don't understand. How can you spend so much money and still look horrible?
Yeah, we have a conversation in the spa just about every day. I'll turn to one of my nurse practitioners that I work closely with, and I'll say, how could anyone do that to their patient? That is too much. That doesn't look natural. There is a thing called body dysmorphia. I don't know if you've heard of it, but we see it once in a while. We'll have people come in, and their lips will be huge, and they'll want more filler. They just want more and more and more. And we have to turn them away. We have to say, no, we're not going to do that. And I've done that many times. But yeah, you look at these movie stars that have all this money, and you wonder who's putting this product in their face, who's doing these surgeries on them, and they think it's okay. I don't think it's okay. It's natural zen.
I saw Miley Cyrus on the cover of Gucci, and I was like, she's awful.
Oh, no. Well, sometimes you'll see them look really, puffy. Like, we call them pillow faces. So faces.
Yeah, like someone beat him up.
Yeah. And then the next season, you'll see them look natural again. So, I guess you just have to
Yeah, the paparazzi are there to capture the magic moment, but they look the worst.
Guess so, yeah. I don't know. I don't get it.
Well, what are some of the newer treatments that maybe people are not very familiar with, but are up and coming?
Yeah. Well, one of the treatments that we do that is just a year old, it's called a TIVA. It's a radio frequency device that has a cannula on the end, and you thread the cannula under the tissue, and what it does, it heats up the the tissue. And by heating up that tissue, it causes the body to then repair itself with new collagen. So it can tighten the skin and it can help with fine lines and wrinkles. We can use it on the face and the body, the neck. We've used it pretty much on all areas of the extremities and also face and neck. And we get really good results with that. Now, these machines, these devices, they are not a one and done. I tell my clients all the time that, you're going to have this treatment, you're going to love it, but probably in a couple of years, you're going to need another treatment. Or some of the treatments that we do, you need multiple of them and then just maintenance once a year. So I would say Ativa is one of the newer out there on the market. There's also new laser hair removals. They're using multiple laser light lengths where it just used to be one length. So it can treat different types of skin tones. There's what's really kind of coming out. It's kind of the new thing I'm hearing about is hair restoration with certain devices. So there's a device called the TED that I just learned about that actually pushes product into the pores to hit the follicle of the hair shaft to help it grow. That's a brand new device that's out right now on the market. We don't have that device, but I'm gonna follow it for a couple of months and see if it's something that would work in our spa. But regenerative medicine is really on the up. I just did a podcast this morning on my podcast, Glow Up and Get Real podcast, and we talked about peptides because peptides are becoming a big thing. So it's not just the devices, it's new meds and new things that are popping up like so fast. You can't keep up with it.
Oh, so you guys do any peptides too?
We do GLP-1s, so semaglutide and tirzepatide, but we don't sell any other peptides at this time. But I am looking into adding that to our practice.
What are some of the peptides available? What do they do?
Well, what they do, wound healing. There's like a peptide for skin rejuvenation. It helps give your skin a glow. It helps repair some collagen. There's a peptide that helps with muscle repair and tendon repair. There's a sexual peptide that's out. There's so many. I can't keep up. I actually registered to take some classes on this Peptide University website because I need to really learn about it. It's something that I don't have time to learn it. I'm so busy, but it's something I have to learn because it's here and it's going to stay and it's just going to get bigger and bigger. So it's always good to be on the front of the new things coming out so that you're ahead of the game.
Okay. So where are you located? Where can you help people?
Yeah, well, so we're located in Fort Myers, Florida. We have a lot of vacationers that come down here, and we are very glad to get them as new clients. We're also in Punta Gorda, Florida, which is a little north of Fort Myers. So we're between Sarasota, Tampa, and Naples.
Oh, yeah, but I mean, your license allows you to help anyone, Florida, anywhere?
There are some rules about how far you can go. So I stay within that jurisdiction, and I couldn't have like a spa in St. Petersburg. It's too far, according to license rules. But Fort Myers and Punta Gorda are really, really close to one another. So
can people drive in or fly in when you could help them as long as they're physically at your place?
Oh, absolutely. Yes, they can. I actually have some clients that fly in just to see me because we have a lot of, snowbirds, a lot of people that live up north and then come down here in the winter. And I do have some that will come back in the summer just so they can get a treatment, which is very flattering. I love that.
Okay. So what's the best way for people to reach your clinics? With a website or phone or?
We have a website. It's sweetspotmedispa.com. And I'm on Instagram. We're on as the Sweet Spot Medi Spa on Facebook as well. And then I have I do some training and things on the side, and I'm called the Sweet Face Injector. So you can find me on Instagram on that as well. And then the podcast. We just started the podcast a couple months ago, and it's called Glow Up and Get Real. Well, actually, it's kind of it's duplicated on Spotify and Apple. I don't know what's going on, so we need to figure that out. But all the episodes are on YouTube on our channel and also on Apple as the Glow Up Get Real podcast. So there's two, one without podcast and one with podcast. So the podcast one is the secret one that has all the episodes.
Okay, very good. Well, thank you so much for coming on the podcast here. I appreciate it.
Yes, thank you for having me on. It was great.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
Thank you for listening to the Good Question Podcast. Please email support@thegoodquestionpodcast.com if you have any referrals to great guests for us to interview. Visit thegoodquestionpodcast.com to hear more interviews. And please help us spread the word by rating and reviewing us on Apple Podcasts, iTunes, Spotify, YouTube, or wherever you listen to this podcast.